Welcome to this edition of Healthy Living. I'm your host, Tim Kelly. On today's program, we're joined by Gina Petrone, Executive Director of the Obesity Healthcare Foundation, and Jaya Tewari, who is Executive Director of the Suffolk Partnership for a Healthy Community. I'd like to thank you both for joining us today to talk about an exciting new initiative that's coming out. And let's talk about that initiative, which of course is Healthy People, Healthy Suffolk, and of course health being the key word there. But let's talk about where this idea came from and how your two organizations came together to bring this to where we are today.
Very good. Well, Obesity Healthcare Foundation's Board of Directors has been looking at the most pressing issues in the community for the last 5 years. And there was a health assessment that was conducted, and really the underlying cause of many of the diseases was very evident that it was obesity. And so the foundation decided to put that as one of their top priorities: obesity prevention and really the underlying causes of disease. Our mission is to prevent disease and improve health for all the people in our region. So that's really where we brought our focus. As we moved into prioritizing that and funding programs that helped improve health and prevent obesity, we started to see that the Suffolk Partnership was also focusing on healthy living and active lifestyles.
Correct.
So it really made sense for our board to partner with the partnership, the Suffolk Partnership, and their board was excited to have that partnership as well.
Great.
And Suffolk Partnership for a Healthy Community has been working on health issues since 1998, since our founding. So the Suffolk Partnership was founded as a community coalition, which means our mission is to bring the resources of Suffolk, from our natural assets to our resources in terms of organizations that are working on and key stakeholders, to a table to address big issues that are beyond the capacity of one organization or one entity to address. And in this context, obesity or chronic diseases that impact all of us in our community and are literally the big issue. We seemed natural fit for this, since the mission of the Suffolk Partnership is to improve the health of citizens of Suffolk. And we take the view of health is more than just absence of diseases. Health is when every citizen in our community not only has the desire, but also the resources behind him or her to pursue health to its best end. So in this way, Obesity Healthcare Foundation and the Suffolk Partnership are the natural partner in this community to not only bring the resources of the community to put the biggest resource, funding, and the collaboration of various agencies and stakeholders to achieve this big goal.
Now, of course, again, the key word here is health, and health can be defined by a lot of different people in a lot of different ways. So how is the definition of health applied to what we're talking about with this specific initiative? How does it tie into that, and how is it going to be kind of worked through the initiative there?
For Suffolk Partnership, we look at health as a broad view of health. And in that way, it's more than just, as I said, absence of diseases. Health to us means when our citizens have the ability, desire, and the resources behind them to pursue an active life, a healthy choices for nutritional meals, and also in terms of at any age and stage of readiness, they have the ability to go outside and be active, have the ability to access healthy meal. There are safe and accessible recreational facilities in the community. So it's at both individual level and the community level. Individuals have the desire to, but that desire is not any good if there isn't the infrastructure in the community to pursue health. So we look at health as a broad view, and also at individual level and at a community level.
Gina?
And I think for the foundation, our board really does look at the individual's health. We're really looking at how we improve the health of the individuals. And it really does work well with what the partnership is looking at in that broader view. But the foundation saw that in the health indicators, which are publicized broadly, Suffolk had some of the highest rates of mortality from diabetes. And diabetes really is that downstream effect of obesity. So they realized that they needed to really look at what were the underlying causes. And when you look at diabetes, it is the lack of activity
Right.
and the nutrition that needs to change to be more appropriate for a healthy weight. And at the end of the day, if we could have all the individuals in our community at a healthy weight, then they would have a healthier life.
Correct. Now, working specifically on the Healthy People, Healthy Suffolk initiative, of course, it focuses on 3 areas that create a sort of a culture that, I guess, brings about a healthier Suffolk. Can you talk a little bit and expand on those 3 particular areas right there?
So in terms of the Healthy People, Healthy Suffolk, it's very simple at its core. Health is about you eat well, you are physically active, and you have community around you that facilitates healthy choices. So at its ultimate, we like to see Suffolk as a community where healthy habits and healthy choices are norm, not a novelty for our citizens. And we have created a community where people can do that. So in terms of nutrition, Suffolk Partnership has already been working, as many of the other organizations in the city, with funding and help from the OBC Healthcare Foundation to provide that resources to the community, provide healthy meal to seniors through grants from OBC Healthcare Foundation organizations are working on. Or in case of Suffolk Partnership, we have established community gardens around the city that work as tools to teach healthy eating habits, benefit of including fruits and vegetables in your diet, and also teach from very start in classroom setting or school setting, or in this case, we are sitting at a venue which is a host for one of those learning gardens where kids in daycare setting actually learn about the habits of healthy eating. So broader goal is how do we not only provide tools and education, but actually resources to our citizens to develop lifelong healthy eating habits. We do that in that respect.
And we want the healthy choice to be the easy choice. And so we want the community to come together. And that's what we've seen as we've developed this plan. Different people from all walks of life and different community agencies, businesses, even the city itself. We've all come together, and that's where we see the sweet spot. That's where we see the real impact is that community engagement around this initiative. And we've seen it happen in communities across the country as they've come together and worked a plan like this plan. And we see this as a long-term goal. It's 10 years in the making, and we hope that as we build, the community will join us.
Correct. How do you see the blueprint for this initiative coming together? I mean, what are some of the building blocks, if you will, to kind of pull this all together and make this dream a reality, so to speak, starting here in late September of 2012?
So as Gina mentioned, this is a long-term plan.
Correct.
This is a 10-year initiative, and there is a reason for that.
Sure.
It took us a long time as society, nationally and also locally, to get to a point where over 63% of our adults are overweight or obese, a quarter of our children are overweight or obese, or the children, I mean, as a mother, one statistics that I always find frightening, that I always keep in mind working on these initiatives, is children born after 2010, 1 in 3 children are likely to develop diabetes. That is a lifelong problem. So as a society, we got to a point after a big, long trend. So reversing this trend is also going to take a long community-wide effort.
Right.
And we plan to do that in segments of 3 years. So the whole point of this plan, having this blueprint, is there were already efforts underway by different agencies, by different organizations at the city level to address some of these issues. But the focus that this plan brings together is to have activity, nutrition, and community engagement be motivated, directed, focused on 3-year segments. So we will prioritize issues that and action on 3-year basis and come back and review. So we will have goals for the whole community, whole city, in the healthy eating area, in the physical activity area, and how do we most effectively engage the community.
Sure.
And also the best thing that this plan brings is the one coordinating agency, a Suffolk Partnership for Healthy Community, tracking and monitoring and collecting data. So that way, as a city, as a community, we can come together and review. This is where we started,
Right.
This is where we are, and what we need to do to change it.
Sort of taking snapshots along the way, so you kind of have
Exactly.
measuring points, so that you're not looking at the start to the finish, but you got some marking points along the way to kind of pick up where we are and maybe any changes or pluses, minuses, or whatever's going on. Correct?
Exactly,
Yeah.
and also that there is no duplication
Sure.
of effort.
Correct.
So it's bringing the resources of community together, all the stakeholders and actors together, and focusing them on one goal so we can all work together and measure along the way so we know what we are doing.
And I think it's also capitalizing on what's going on across the nation. I mean, I think it's no secret that Michelle Obama has really pushed the active lifestyles and the healthy eating for children, and the nation is getting excited about that. And so we want to make sure that we're capitalizing on that we're incorporating the national movement into our local initiatives. And we're also hoping to bring in national funding. OBC Healthcare Foundation is happy to fund many of the projects that will be incorporated in this plan, but we hope that we'll bring in funding from the state and from the nation to help us build sidewalks and trails and community pathways and water activities. So we're not in this alone, we're all
Correct.
working together.
Right. I mean, again, you have your partners within the community, want everybody working again to build that healthier Suffolk, which is what we're really that's what our goal really is on this project. Well, what is ahead for Healthy People, Healthy Suffolk? What are we stepping up to with that?
On September 29th, we are launching this initiative publicly. So that's our big public launch. We will have a 5K and 1 mile walk and run, and that is open to community. And we will have seniors and children and families coming together at the Constance Wharf to celebrate start of the implementation process. So we have spent 18 months coming together with this plan, which is very well laid out and has all the goals and the activities defined. But now it's time to get to work. So on September 29th, we launched this. In the meantime, we are putting together the infrastructure. We are coming up with the measurements for how to track and monitor the data. We are working with agencies that will be implementing different segments of this plan, and we will be working with our citizens to engage them. So.
And our goal is to really see people more active, living active lifestyles, having a better health outcome so that they feel better after they've exercised. They are more encouraged to play with their children, to be out in the community, to take advantage of the resources that we have here, the water resources, the amazing playgrounds and sidewalks and downtown, and just be a part of that and be active, be moving, and to eat healthier, make healthier choices. And we're already seeing that happen, so we're really excited about the future.
Great. Well, Gina and Jay, I appreciate you being with us to kind of talk about just a little bit about Healthy People, Healthy Suffolk, and we're going to have more in just a second. Joined now by Patrick Edmunds, Program Manager for Healthy People, Healthy Suffolk. Patrick, thanks for joining us.
Thank you.
Now, of course, you're new to the Suffolk Partnership for a Healthy Community. Talk about what brought you here to Suffolk and specifically to the partnership to work on this initiative.
Sure. Well, before coming to Suffolk, I worked for the YMCA in the greater Richmond area. And at the Y, we were very concerned with healthy eating, active living. And so when I came to Suffolk, it was kind of a natural fit for me to look for a community-based organization that promotes some of those same values. So, and this has been an exciting time to become involved with the partnership as a grassroots organization and initiative to really promote the well-being of all, everyone in Suffolk, all Suffolkians.
Exactly. Well, you know, in the earlier segment, we talked a little bit about the initiative, kind of some of the thought behind it and some of the plans along the way. Can you talk about what's going on behind the scenes with that initiative to kind of get it rolling? I mean, obviously you're coming in, as you noted, at a very good time.
Yeah, well, we've been very busy behind the scenes. We are preparing for our public launch of this program, and behind the scenes, there's been a lot of activity, good activity. We are currently convening an advisory committee made up of leaders in the Suffolk area, business leaders, faith leaders, and nonprofit leaders. And those folks will be providing some strategic vision and guidance along the way as we transition from our planning phase of this plan to now our implementation phase. So I know, as Gina and Jaya mentioned earlier, our planning phase was about a 2-year process, and we're now just at the cusp of launching this program. We're also behind the scenes getting some groups together, some work groups, and we have doctors, we have nurses, we have community leaders, we have our nonprofit agencies are helping out with that. And these are really going to be the folks on the ground promoting our mission and instituting these programs that are going to promote health and well-being for everyone in Suffolk.
How do you see Healthy People, Healthy Suffolk fitting into what the partnership's overall kind of mission and goals are?
Sure, that's a great question. One great thing about this program, this new program, is that it really connects a lot of the work that has already been happening in Suffolk. So within the partnership specifically, we have a number of community gardens throughout Suffolk. We currently have 9, and we'll be adding more in the coming months, including with our public schools. We're partnering with them to add gardens at a lot of our school sites, so that's an exciting thing that we're doing. Also, we have Suffolk on the Move, which is our program really to promote all activity. We have 5Ks, we have bike races, Wii bowling tournaments. So we have a lot that we're doing in the partnership, but we also are doing a lot of partnering with other agencies in the community. So our partners at the YMCA, our partners at the Planning Council, the public school system. So a lot of good things are already happening in Suffolk, and Healthy People, Healthy Suffolk is really about managing all of that and connecting all the dots between what's already happening out there, and then to add more to what's happening.
Now, if someone's sitting at home or watching on the internet, watching this interview and saying, okay, this Healthy People, Healthy Suffolk sounds great, how can I get involved? Who can get involved?
Sure. Well, the quick answer to that is everyone. So if Suffolk is a part of your life, then we want you to be a part of this program. So what we tell people when we go out into the community is that if you live, work, play, or pray in Suffolk, then this program is for you. So it's all ages, it's all walks of life.
Now, September has been designated Childhood Obesity Awareness Month. How does the initiative tie into that, as far as how are you connecting the dots on those items?
Sure, it's a great connection actually, and it's great timing with the launch of our program. Like I just mentioned, this program is for everyone, all ages, but obviously childhood obesity is a huge problem right now, and that's really has been a very vulnerable audience for us. So we are really excited to promote that initiative for the month of September, and especially with partnering with some of our other agencies, YMCA and public schools and Parks and Recreation, and these agencies who are also already working with children. So one thing we all have in common is we're all kids at one point.
That's right.
So that's one thing that cuts across, you know, all of Suffolk. So we're really excited to promote the Childhood Youth Obesity Awareness Month.
Now, of course, you mentioned the fact that we're getting ready to kick off Healthy People, Healthy Suffolk, but what are some of the exciting and maybe interesting ways that you're looking to kind of really get the ball rolling on this project? Sure.
Well, first and foremost, we want to let everyone know about our official public launch. It feels to me like it's already launched because we've been so busy, but our official public launch is on Saturday, September 29th. It's at Constance Wharf here in Suffolk, and it's 7 o'clock in the morning. It's in conjunction with our Peanut Fest 5K. So come out and enjoy our kickoff event, and also sign up, and you can do a 5K walk or run. And we also have a 1-mile option this year as well. So that is at 7 o'clock on the 29th. We have some guests who will be with us. The Mayor, Linda T. Johnson, will be there, and we also have Sam Glasscock from the OBC Healthcare Foundation, that's our funding agency, and also Caroline Martin, who is the president of the Suffolk Partnership for Healthy Community, will be there giving remarks as well. So we have a website if you would like to sign up for the 5K and come out and join us. And I should also mention, I think I left this out, it is a free event. So all you have to do is sign up and just come out. There's no cost involved.
Gotta take that first step.
Exactly. So we want to make it easy. It's easy to sign up. Go to our website. It's suffolkpartnership.org. And there's an easy online registration there, so you can take care of that. you can also give us a phone call if you'd like more information or if you'd like to register. And our phone number is 539-1525.
Okay. Now, you mentioned some of the groups and organizations in the community that you're looking to partner with and work with. How are you looking to tie them in? How are you looking to bring those organizations into what you're talking about doing here?
Sure. Well, like I mentioned, a lot of these groups are already running fantastic programs
Sure.
that fit naturally with our goals.
Right.
One of those is the Planning Council, and they're working with child care providers to provide healthy and nutritious meals for the kids that they work with.
Right.
Also, the YMCA is a huge partner, and they have a great jump rope program that increases youth's cardiovascular endurance, and it helps to fight childhood obesity. And then Suffolk Public Schools is also a great partner with us, just helping to have more of a focus in the classroom
Right.
and in the cafeteria on
Sure.
healthy eating and active living.
Now, of course, we're getting ready to close the program here, but talking about healthy people, healthy Suffolk. We talked about a lot of different things over the course of the program, but anything you want to kind of make sure you highlight before we close and or bring into it that maybe we haven't talked about already?
Sure. Well, just again, we really want to emphasize that this is a collaborative community effort.
Sure.
You know, the Suffolk Partnership is now managing the implementation of the plan, but this plan really started 2 years ago with the OBC Healthcare Foundation as our generous funder. They are the ones that have awarded us the grant. They've awarded a grant to the partnership to implement this program. And all of our community leaders who served on our steering committee and our planning committee, and all of those folks in Suffolk who really know Suffolk and
Right.
know what Suffolk needs.
Right.
So these folks have really been a huge critical part of getting this plan together. So we're very grateful to them for their service to this cause. Also, we just want to let everyone know that this is an outcomes-based initiative. So, you know, awareness is a great thing, but we also are seeking outcomes.
Sure.
So it's a 10-year process, and we're breaking that into 3-year manageable chunks where
Right.
we can have milestones along the way and report back to the community. And then lastly, we just want to reemphasize this really is a program for everyone,
Right.
and it starts September 29th, and we want to see everyone out at Constance Wharf at
Sure.
7 o'clock on the 29th for our 5K run walk.
Okay, well, Patrick, thanks for being with
Thank
us
you.
to talk about healthy people, healthy Suffolk. That will do it for this edition of Healthy Living. Here's to your health.